Hello, and welcome to this edition of CRHS Health Talks. My name is Stephanie Miller, and I'm the Physician and Community Outreach Coordinator for Columbus Regional Healthcare System. Today, we are going to be speaking about COVID-19 and pregnancy. If our two guests would please introduce yourselves.
Hi, I'm Lisa Garrell. I'm the lactation consultant at Columbus Regional, and I'm also a staff nurse for the newborn nursery.
Thank you, Lisa.
And I'm Peter Kindschuh. I'm a OB-GYN here in Wyoming. Do active obstetricians in our family birthing center.
Thank you, Dr. Kindschuh. Thank you both for taking the time to be with us today and talk about this very important topic. Being pregnant today, I'm sure, unlike any other time in our history, raises a lot of anxiety. So that's what we hope to speak about today, to ease your anxiety if you're pregnant during the COVID pandemic. Dr. Kindschuh, what are the risks to pregnant women from the coronavirus?
Well, in pregnancy, as in almost everything else with the coronavirus, there's just a lot that we don't know. The good news is most pregnant women are young and they're healthy, and most young, healthy people don't tend to be severely affected by the virus. So the majority of the cases that we have seen have been relatively mild infections, and they will tend not to have any major impacts in pregnancy. Obviously, for people who have more complicated medical issues, the chance of getting into a more complicated clinical course is higher. The chance of getting sicker and requiring a lot more intervention goes up. But for the vast majority of women, it's a process that tends to just require some management, and waiting for the time of the virus to pass is what's involved.
Okay, that's good to know. Lisa, if I'm pregnant, ready to go to the hospital, am I allowed to have someone with me? Can I have a visitor?
Yes, absolutely. You are allowed to have one support person with you during your baby's birth and the duration of your stay. A woman should have someone nearby to support them, as long as the proper precautions are taken, such as wearing their mask and washing their hands. However, if you are COVID positive, your support person
Lisa?
You there?
Yes. Are you still with us?
Went away for a second.
Okay.
I can see y'all now.
All right. If you'll continue, you were saying they can have one person or support person with them.
Yeah, they can have one support person with them during their birth and the duration of their stay. A woman should have someone nearby to support them, as long as the proper precautions are taken, such as wearing their mask and washing their hands. However, if you are COVID positive, your support person must stay in the room at all times until discharge.
Now, can that be, your support person, does it have to be the same person the entire stay?
Yes, it has to be the same person the entire stay for our floor.
Okay. All right. Thank you for clearing that up.
Yes.
And I think it's important to note that part of the routine with our OB patients coming to the hospital is that every obstetric patient who is admitted who's going to be delivering will be coronavirus.
Okay.
We do a rapid test so that we know what the patient's status is as labor gets underway. If delivery is something that's scheduled, like an induction or a scheduled C-section, then that test is done prior to admission. If it's labor that happens spontaneously, we do the test at the time of admission.
Okay, so everyone who comes to have a baby will be tested for COVID.
Yes, and it's okay. The visitor situation is a little bit special. We make the basic assumption if the patient and their support person live together, and the patient is negative, then we don't do testing or don't require testing of the support person. If somebody's planning on having a support person that comes from some other location, let's say a mother or a husband who works distantly but is going to be home for delivery, then we do require that the support person be tested prior to their coming to the hospital, so we know what their status is.
Okay. All right. Thank you. And Dr. Kindschuh, tell us a little bit about what you're doing in your office to keep your pregnant patients safe, as well as both of you can probably tell us about what we're doing here at the hospital to keep pregnant moms safe.
Well, probably the one major change that people are clearly aware of, and it's got its ups and downs, is that we have no visitors allowed with patients coming to the office. And what that does is it keeps the waiting room less crowded. It reduces the risk that somebody who comes into the office to be seen ends up being exposed by an individual who hasn't been tested or doesn't have symptoms or risk factors. In cases where we do have patients who have tested positive and we know that they are positive, what we are doing is arranging their appointments so they come as the last patients of the day. And we see them essentially after all of our other patients have been scheduled. Some small things like having them come in the back door and go straight into an examining room. After the visit, they're terminally cleaned and not used again, typically at least until the next day, or sometimes even over until the following week. But it just helps to minimize any potential that somebody inadvertently gets exposed in the office setting.
Cool.
Okay. Basic requirements. Patients are required to wear a mask, which is probably, it's a single thing we'll say over and over again. In the office, coming into the hospital, wearing masks is one of the most significant things you can do to reduce the risk of spreading the virus to somebody else or getting exposed yourself.
Right. Thank you for reiterating that. Lisa and Dr. Kindschuh, what are we doing in the hospital to keep the pregnant moms safe?
Well, like he said, wear your mask, wash your hands. If a mom is positive, we have a special hall for our COVID moms that are on with their babies and their support person to stay in. They are expected to wear their mask at any time any healthcare worker is in the room with them. And with the baby in the room with them as well, they should keep their mask on. I'm sorry, your text.
Patients will notice is the staff is wearing masks at all times. The nursing staff and everybody that they will have contact with on the floor, whether it's physicians or nurses or nursing assistants, will be wearing masks. There's more hand sanitizer being used to an extent we just haven't done before, but it's part of what we deal with.
Okay, very good. Thank you both. Lisa, are moms allowed to keep their babies with them after delivery?
Yes, it's very important for a mom and baby to stay together. The babies here at Columbus Regional room in with their mom at all times unless there is a medical indication for separation. Babies are rarely separated from their mom. If you are COVID positive, your baby still rooms in with you. However, we do expect you to wear your mask when holding and feeding your baby or performing any other close-up baby care. And of course, always wash your hands first.
Okay. All right. Dr. Kindschuh, what should pregnant women do to protect themselves and protect their babies?
Well, the obvious goal is, first is doing everything that you can not to be exposed and not to get infected. And while that seems really clear, and I think the vast majority of pregnant women do understand that the best way to deal with this virus is simply not to get it. And that means what you do with your own activities, as far as going to the store, as far as being in social groups, wearing your mask anytime that you're in public, and just being extremely vigilant. That's important, but you also have to be alert to what the people that you're with are doing. If the father of the baby or the patient's mother, if there's somebody that that is in a higher risk environment and then are around that individual, the chance that they end up with exposure certainly goes up. And this is something that in the cases we have had of women who have been positive, more often than not, it's a family member, who is in a work environment or a social environment where there's been exposure that our patient then becomes exposed. So I mean, the single most important part is the basic recommendation that you're hearing from all the experts about wearing masks and hand washing and social gatherings. And, unfortunately, weddings and funerals and big family reunions are not a good thing. And when you are dealing with pregnancy, you want to be extra vigilant about protecting yourself from that kind of exposure.
All right. Thank you. And Lisa, can the new moms safely breastfeed their baby? I know a lot of them are wondering that. If they're COVID positive, can they still breastfeed?
Yes, breastfeeding is the best thing a mother can do for her baby. Antibodies to protect your baby from many viruses are passed through your breast milk to help protect this baby. Any immunity that can be passed to your baby during these unsure times is of great importance. Transmission of active COVID-19 through breast milk and breastfeeding has not been detected to date.
That's good.
If you suspect you have the COVID-19 virus, it is important to seek medical care early and follow instructions from your healthcare provider. Mothers well enough to breastfeed should take precautions, including wearing a mask, washing hands before and after contact, and cleaning their surfaces. If you are too ill to breastfeed, express milk and give it to your child through cup or spoon and follow the same precautions. Very important.
Yes, yes. Okay. Well, I thank you both for being with us today and talking about this very important topic. And pregnant or not, just remember to wear your mask, wait 6 feet, and wash your hands. And we thank you for being with us today, and we look forward to seeing you on our next edition of Health Talks. Have a good day.
Thank you.
Thank you.